This lecture is for the history of physical therapy. So there were two major events that occurred in history that had a large impact on the profession of physical therapy. They were World War I and polio. So prior to these events, the general view was that disability was irreversible. The war, however, changed this because we had a large number of young men that were coming home with major disabilities. And this is often referred to as the Reconstruction era. As I mentioned before this, Americans often didn't think that medical intervention was needed or was necessary after an injury. During this time, orthopedists as well as reconstruction aides kind of jumped in to help individuals recover from their disabilities or their injuries from the war. Reconstruction aides ended up being young, unmarried women that were recruited to assist orthopedists in managing disabilities and injuries from the war. These reconstruction aides were actually divided into two groups. They were divided into one group that would assist recovery of injuries, and then the other group would assist with helping with vocational skills, like activities of daily living. And those ended up being our occupational therapists, whereas those reconstruction aides that were assisting with recovery from injuries ended up being the physical therapists. When the U.S. entered World War I, the government got involved. The U.S. Congress passed some legislation or changed some policies that made it a requirement for permanently disabled servicemen or soldiers to get rehabilitation. And then in August of 1917, the Surgeon General of the U.S. actually developed a division of special hospitals and physical reconstruction groups to assist the veterans when they returned home. So these policies put in place really helped the veterans because there was a large need for rehabilitation. As I mentioned, polio was also a large influential factor for the field of physical therapy. Polio had been around in the early 1900s and resulted in paralysis of a lot of patients. In 1929, the Great Depression occurred, which also prevented a lot of people from receiving a lot of treatment or rehabilitation that they needed. We'll talk a little bit later about the different facilities and schools that were developed and founded over time, but a lot of these major events that occurred in American history increased the need for jobs in the field of physical therapy. In these early years, the PT equipment or PT environment was a little different than what we have now. They had an exercise gym the way that we have now in a lot of our clinics. They had a whirlpool room, which was specific to hydrotherapy. So whirlpool techniques, there's different sizes of whirlpool machines that are, you can just put one extremity in versus they have full whirlpools where you can put your entire body in. They had a massage room where there would be soft tissue work being done, a wound packing room where they would do wound care. Their mechanotherapy is what we would think of as our gym today, where we have weights, pulley systems. Back then they would use different types of equipment like trolleys and different wheels to provide resistance to complete these exercises. There's also an electrotherapy room, which included the modalities that we use today, such as electrical stimulation. So there are some similarities, but also some differences from what early on in physical therapy used to look like. So one of the first reconstruction aides that had a really big impact on the PT profession was Mary McMillan. And she is well known within the field of physical therapy. There's actually a Mary McMillan Award that's given by the APTA every year. So Mary McMillan was born in the United States. Her mother and her sister passed away, so she moved back to England at the age of 5 to live with relatives. She ended up getting a degree in physical education and then a degree in physical therapy, and she started working with an orthopedic surgeon back in England, so Sir Robert Jones, so that she was one of the first professionals to start working in that type of position or that type of environment. She returned back to the U.S. in 1916 and worked at the Children's Hospital in Portland, Maine. And that was before they recruited her to be involved in the military rehab environment. So in 1918, she went down to Walter Reed Hospital in Maryland, which is still around. It's a common place for veterans to receive their rehab. And she began working with the U.S. military. And she did such a great job, and they felt that there was such a need for reconstruction aids to help these veterans that they wanted her to start training them. So she started a training program that they called the War Emergency Training Program. So she started the curriculum. And actually the first training center was in Oregon. And her training curriculum went so well that they actually started making that the standard of education practice for training reconstruction aids. At the end of the war, there was definitely a decline in need of military intervention for veterans. There was a decrease in military hospitals and a decrease in reconstruction aids. So the Army kept physical therapy until about 1921, but after that, Mary decided to leave the military and more go into private practice. Before she did that, though, she formed the AWPTA, which was the American Women's Physical Therapeutic Association, because if we remember, our reconstruction aides were young, unmarried women at the time. So it is fairly a female-dominated profession. After leaving the military, Mary wrote a book, Massage and Therapeutic Exercise, and published that. And she became the first president of that AWPTA. That first organization had 274 members that represented 32 states. That was the very first year. It has definitely grown over time since then. And as I mentioned, she was the president. She had her book published. And in 1922, they changed the name from the American Women's Physical Therapy Association to just the American Physiotherapy Association. And they started opening new schools to train more physiotherapists. So graduates back then were referred to as physiotherapists rather than physical therapists. Continuing to move through the time frame, from 1940 to 1970, there was a significant period of growth within the APTA, within the organization, and for physical therapists. And we'll kind of go through that a little bit. In 1941, that War Emergency Training course, they started a training group at the Walter Reed Hospital in Maryland that started training and graduating physiotherapists. There was another event in 1941. We had the bombing of Pearl Harbor, so now again there's an increase in need for rehab and physiotherapists. In 1943, the name actually changed from physiotherapist to physical therapist. And if you've traveled outside of the U.S., all other PTs are referred to as physiotherapists. That tends to be a U.S. terminology. In 1946, the American Physiotherapy Association became referred to as the APTA, and the physicians that were involved in rehab within this field now became known as physiatrists. So they were physicians practicing physical medicine, and they were titled as physiatrists, which is still a name that we use today. So during that time frame, so from 1940 to 1945, there was actually a change in the presidency of the APTA. So Catherine Worthington was an early PT that took over as president of the APTA. She had a doctoral degree in anatomy, and she is another pioneer of the field of physical therapy. And the APTA also has a Catherine Worthington Award that they give out to someone every year that is very deserving. From 1948 to 1960, within this time frame, there was more of a focus on polio patients and working with them and strengthening them. Because if you remember polio, we saw a lot of paralysis and muscle weakness. So there was a switch in the emphasis within the field to focus more on these polio patients. And one of the things that was developed during this time frame, so in 1954, Jesse Wright came up with a technique to grade muscle strength. And people started testing muscle strength and evaluating that. And this is what we call today our manual muscle test. So they would do manual muscle tests to find areas of weakness or these strength deficits within these polio patients so that we could work on strengthening them. So continuing to move through our time frame, Congress added physical therapy to the Social Security Act. This allowed Medicare and Medicaid, basically insurance, to reimburse physical therapists for their treatments. A lot of programs were developed during this time. OSHA, so the Occupational Safety and Health Administration, was developed, which allowed physical therapy practice to start focusing on injury prevention, work management, work-related injuries, job-related injuries, things like that. The Individuals with Disability Act, the IDEA, that allowed PTs to expand to pediatric patient populations and children to get involved in the schools. And in the 1970s, the states now started developing licensure and regulation requirements. So now you could be licensed as a physical therapist at this point. And in 1978, the American Board of Physical Therapy Specialties was created. So we had different areas of treatment such as sports, orthopedics, geriatrics, so different areas started developing. In 1988, we started working towards direct access within different states. So that would mean that a patient can walk into a physical therapy clinic without a prescription from a physician or a doctor, and they could treat them. So in 1988, we only had 20 states involved. However, as of January 1st of 2015, now every single state has direct access. And this is really great. So again, patients can just walk in off the street with an injury, see a physical therapist, without having to go through a doctor's appointment and see someone to get a referral for PT. PTAs have also been involved in this time frame. So in the 1960s, we started seeing an increase in the need for rehab and intervention. The elderly patient population doubled. There's more of an increase in health and public awareness of health and different conditions. So Medicare and Medicaid programs, they led to an additional demand for physical therapy. So physical therapist assistants kind of came into the scene at this point because there was a need for additional help in the rehab world. In 1967, the APTA started adopting policies to standardize physical therapy assistant education, and I have that underlined and bolded for a reason. So previously it was physical therapy assistant. In 1969 it changed to physical therapist assistant, and in 1969 actually that's when the first two classes graduated from programs with associate's degree. They're both in Florida. One was Miami-Dade College and the other was College of St. Catherine's. In 1973, PTAs became affiliate members of the APTA, so they were an affiliate organization. They weren't as involved in the APTA. In 1983, they developed a special interest group, or SIG, it's often referred to, of PTAs. In 1989, that affiliate assembly of PTAs started actually giving a formal official voice within the APTA to speak and represent PTAs. In 2005, however, there was a little bit of a change. The National Assembly of PTAs actually dissolved, so that group of PTAs actually switched from an affiliate organization to actually become now a PTA caucus. So it sounds like it's a bad thing, but it's actually really good. So PTAs, as being a side affiliate organization, said we don't want to be in addition to the APTA, we want to be integrated and involved in the APTA. And that's what the PTA caucus is. So they're more integrated, they're more involved in the APTA board.